Well, thank you, folks. It's a great pleasure to be here, and I'm always honored when I get invited to speak with Iowans, and especially folks like you who dedicate so much of your time to an important cause and important issues. I'm going to talk very briefly about, let me tell you what I wrote a couple of minutes ago. I said, what I share with you today are the perceptions about healthcare and health insurance in this complicated e pluribus unum country and state. I didn't have e pluribus unum in there before Ken started talking about it. Kirk, I'm sorry. But I added that. I also want you to know that they may not be my opinions or my prescriptions for healthcare reform. The opinions expressed here may not be those of this station, its management, this organization, or even this guest. I am the bearer of some good and some bad news, but I take no credit for any of it because I'm simply a transmission to you of what is going on. I just finished my radio show on Iowa Public Radio at 10 to 11 down the street here in their studio. The entire show today, we do it every Wednesday at 10 o'clock, 640 on your AM dial, or streaming live on the internet at iowapublicradio.org. Was on healthcare, health reform, the summit meeting that is going to take place between President Obama and Republicans. I urge you to look at today's New York Times, which I have here. The front page of it has two interesting stories about that meeting, which is a kind of interesting phenomenon after an entire year of discussing healthcare, health insurance, health reform, the costs of healthcare, and we now are waiting to see what emerges from this particular meeting. And what was interesting was that there was actually a lot of skepticism that this is really about healthcare and health reform and insurance. There were a lot of people who said this is really about politics. And it is, to me at least, both fascinating and also to some extent tragic that something as important as healthcare, which is something that no one can live without, should have become so politicized that we are now very cynical about how to address it in the political arena. I think the Iowa legislature is a much better venue. People know each other, respect each other more, are more respectful to each other. You're closer to them. And it's wonderful to know that citizen participants in the United States, such as you, are willing to take out the time from your busy lives to try and shape public policy. If we could do this in Washington, D.C., healthcare reform would have taken a completely different direction and shape. We would have had a more serious discussion than what has happened. I'm not going to bore you with too many numbers, so I'll skip through those because I know that you're familiar with them. By 2050, just simply paying interest on the national debt would consume more than half of the annual revenues of the federal government, and those three, Medicare, Social Security, and Medicaid, are growing much faster than the economy. And as the economy fails to grow fast enough, the percentage of those increases geometrically. There's an article today in the business section of the New York Times, and one of my former students, Steve Wood, at Iowa State, is now the chief market strategist for Russell Investments, said that the economy isn't really dead and consumers are damaged but not dead. He said things are not deteriorating, but they're not really measurably improving in terms of especially housing and jobs. And as that happens, you all know how that reverberates into things such as healthcare and health insurance. So the economy on one end of this is a crucial factor, as you all know, and we need to keep our eye on that. Eliminating the fiscal gap through 2050 would require tax increases right now or program cuts that would be about 3.2% of the total wealth of the United States, all the way through 2050. You notice I have an obsession with the 2050. It would be politically impossible, and it would be not a very good idea to attempt to do that and to increase taxes by 18% and reduce all programs by 15%, including Social Security, Medicare, defense, anti-terrorism, education, veterans benefits, and so on, would be an incredible trauma on American society, and it would certainly affect, as you know, the healthcare system. We are faced with the necessity of having both sides, the revenue and the expenditure side of the budget, on the table when we talk about how we are going to address this issue. And unfortunately, on the revenue side, we have become a country that is reluctant to deal with revenue, to raising more funds and finding more ways of financing things. And on the expenditure side, in health care, we are struggling with ethical issues and moral issues, and as well as political issues, because we rarely want to talk about how we are going to ration health care. We rarely talk about how we are going to essentially deny health care at some point, or reduce health care at some point in people's lives, because we just can't seem to address that from a moral perspective. And that is a challenge, as you know, because as this country gets older, and I'm getting older by the day, we are facing those things as we get older, and we are having real problems in sorting them out as issues that we can basically deal with. So there are organizations, Imagine 2050 is a blog that talks about this. It seems like 2050 is a long ways off. I know that you folks have to be back at the State House at 1 o'clock. That's more realistic in terms of a time frame. But 2050 for healthcare, for reform, for how to rebuild the American economy, and how to wrestle down this massive deficit that we have, it really isn't that far off. When I came to Iowa State in 1970, I thought that 2010 was way off, and I didn't even know where I would be. I'm fortunate to have been at Iowa State for 40 years, and I'm really thrilled that I am in Des Moines, Iowa today in 2010, but it seemed very far off. Well, 2050 is coming pretty soon, and I think we can at least begin to talk about how we are going to move in the short term, but also how we are going to move in the long run. Obviously, we have a real deep and very trying conflict between public and private.